today for the Economic Recovery and Revitalization Town Hall. We have, as always, great speakers that are going to give us a lot of good information. We have a lot to cover in a short time, and some of our panelists have other urgent matters to attend to. So we are going to start with our Dr. Gales and Dr. Stoddard. What we're going to get is a quick vaccine update. We're also going to just talk about the new changes in the executive order that is in the hands of council and should be decided upon next Tuesday, as well as talk about how to help businesses start to prepare for what should be the upcoming spring as we still go through the pandemic. So I'm going to stop right there. I'm going to turn it over to Dr. Gales, who normally kicks it off. And Dr. Gales, thank you for joining us. Thanks for being here. And thank you in advance for the information you're about to give us.
Thank you, Jerome. Always a pleasure. And to everybody watching, happy Friday and happy to answer your questions. I will go through this very quickly. I do have to step off for a call with the state delegation. But updates for us, our numbers are trending downward compared to where we were a couple of weeks ago in terms of our measures of community transmission, including test positivity and our case rate per 100,000 residents. That doesn't mean we're out of the woods, but we've definitely made some progress in terms of seeing those numbers in the 100 to 200 range versus 500 to 600 at a state level, in the 1,000 to 1,500 range versus over 3,000. Our hospitals utilization numbers have plateaued, and we're continuing to watch those. Now, certainly what we are keeping an eye out on is the presence of the variant strains within our community. You may have heard that there are two strains in particular, the UK strain and the South African strain, that are present in Maryland. We received some preliminary results that we potentially had some residents within the county who tested positive for those. We're continuing to follow that and complete that investigation. But what's concerning about that, obviously, is these variant strains are more contagious than the novel strain that we've been dealing with throughout the last year. So all that to say that we're continuing to monitor that, and we'll adjust our guidance accordingly. In the meantime, continue business as usual, meaning face coverings, physical distancing, and the restrictions we have in place on different activities across the board. Now, from the vaccination standpoint, we continue to put out the vaccines that we get from the state. It is really a game of allocations and capacity. We are, unfortunately, there's still not been an improvement in terms of when we're notified of our doses the following week. It's Friday, 3 o'clock in the afternoon. I have some general potential idea of what we're going to get for the health department next week, but it's not been confirmed. We do suspect that due to the actions of the new administration, that the states will see a bump in the amount of doses that they're getting. But how those doses are doled out from the state to local jurisdictions is still up in the air. They're still controlling that process. And so we know that we've seen our allocations for the health department cut over the last week. We unfortunately suspect that that might happen again this week. At the same time, we know that they are pushing more doses out to other vendors within the community, including retail pharmacies and those kinds of spaces. We are working and leveraging all of those doses that come to the county as best as we can to ensure that there's a fair, equitable process in place of administering and dispersing those doses, and those who are most vulnerable based upon their age, their health status, as well as the type of work that they do, ensuring that they get access to the vaccine in a timely manner. I'll stop there. I won't go into more specifics. I'm sure you'll have some specific questions related to that, but happy to answer. And I'll turn the floor over to Dr. Stoddard to talk about some of the other issues that Jerome mentioned. Thank you.
Yeah, just talk a couple other things. As you're well aware at this point, we are still in tier 1 of phase 1B. We've vaccinated approximately 22,000, a little over 22,000 75-year-olds at this point, 75 and older. We estimate we have somewhere in the range of 73 to 75,000 in that population, and so we're about 30% into where we need to be to move on to additional tiers. We're vaccinating at this point across all the, not just the county clinics, but also across all the apparatuses, the Giants, the Safeways, the hospitals, and others, about 11,000 of those individuals in 75 and older population per week. And so you can do the rough math on how long it's going to take us at the current level of vaccine to get through that population to move on to additional populations. There's been discussion, obviously, through a partnership with Johns Hopkins, both the public and non-public schools are having appointments scheduled for educators and staff this week as well. We are doing a small launch with our child care providers and looking to obviously address the different, other needs as well. But obviously, the farther down the list of priorities that we go, the harder it is to address any specific area, given the amount of doses that we as a county are receiving and frankly, the state is receiving still. The other piece that I want to mention is obviously the county executive did submit a new executive order to the county council for their consideration on indoor dining, 25% allowance with up to an hour for parties inside the indoor dining portion. I believe the county council is scheduled to consider that on Tuesday and vote on it. If they were to vote in the affirmative, it would take effect on Tuesday afternoon. Obviously, we're still in discussions with the county council as they, obviously some have expressed some concerns about that. And so I don't know necessarily whether they will approve that or not, but obviously it's for their consideration at this point. Dr. Gales, I think, have been pretty vocal about the concerns that we have about any inside activity where you can't consistently wear face coverings. We've heard lots of questions about sports and other activities in addition to indoor dining, and I think we've been pretty consistent about, you can only make so those activities so safe if they involve no face coverings indoors, extended periods of time, and people that aren't part of the same household. And so those are obviously have been and will continue to be our concerns about this whole many of the things that we're dealing with in the pandemic. However, the county executive does recognize that the economic impacts have been substantial and will continue to be substantial even at a moderate reopening or a reduced reopening. And so obviously in balancing those two things out, he has decided to move forward with this recommendation to the council, and we will see how they act, obviously, and we're very interested in continuing to evaluate the numbers. If we continue our downward trends, there will be lots of conversations to have about additional potential reopenings over the coming weeks and months, particularly as we increase the level of vaccination in our community and hopefully decrease the amount of COVID. And then we can have much more substantial conversations about how this spring and summer will look for activities. We started to think about that, thinking about even recreational activities over the summer. We've essentially said, you should plan for being able to do some activities this summer, but I would not expect to be able to do 100% capacity in June and July. And I think that's where I think we're at. We're hopeful that if we have additional vaccine, we can get through the populations faster, and maybe we'll be in a better place by June or July. But it's sort of we're trying to read the tea leaves as well as anyone else is, and so we're hopeful about our ability to get vaccine out. We just need more vaccine to come down through any avenue in the county, not just the county health department, to our residents. And so I think that's all I have to start with, and we can answer questions.
All right. Well, thank you both. I do appreciate it. Helpful as usual. We do have a couple of questions. I have a question before we get to their couple of questions, which is, based on the variants that you discussed earlier, Dr. Gales, and I've heard about, the recommendation to double up on masks. Are we at that point yet where we're recommending that, or is that just something that people need to be conscious of, that somewhere we might be going as a recommendation in the future?
Well, as it currently stands, we're not recommending it or mandating it. What we're doing is just providing good information to suggest that it has been proposed by, folks at the federal level, that this is a good practice to utilize, and just making sure that folks, are linked to the proper information so that they understand how to do it properly, so that they get the maximum benefit and are doing it safely. But at this time, we're not mandating it per se.
All right.
It's certainly something that in Europe they are doing more as they have more of the variant strains that are more transmissible. Obviously, this is going to be something that's going to be monitored continually, not just in Montgomery County, but the state and federal level as well. Obviously, if there was any recommendation from the CDC or other national organization based on the information they have from what's happening in Europe, I certainly think we would follow that guidance pretty stringently. Obviously, the challenge also being we still need to make sure that those masks and higher quality masks and volume of masks are still fully accessible in our healthcare settings as well. And so that's obviously the balance that I'm sure the federal government is considering as well.
Okay, you got it. Thank you. The first question we have from our viewers is, can a venue host up to 10 people at this point for an event? I think that goes back to probably the last executive order where there was the limit of people that were actually able to be indoors for an event at this time. Or I think what we were considering gatherings of 10 people or less. So let me stop talking and let you answer the question.
Yeah, so there's been no change to the capacity limit. So I believe it was 10 for indoor and 25 for outdoor gatherings. We've not, as part of the executive order that's gone over, any changes to that are not included in that executive order.
Okay.
And if you do have a question about a specific kind of event, we have a portal, not just for letters of approval, but also just to ask questions. So if you have a specific kind of event that you're looking to organize and you're trying to understand whether it's allowable, but also how you can do it safely, you can certainly ask that as a question.
Okay. Next question is the hour restriction for indoor dining restricted to diners or for parties that are indoors? I think what they're trying to separate is the restaurant, are they restricted to the 1 hour restriction versus me having a party at a particular indoor establishment that is not necessarily a restaurant? Are we still limited to the hour if I have a birthday party in a conference room, in a hotel ballroom?
I think the expectation was that this is for diners within indoor dining facilities, capping it at an hour. And certainly, if folks are having other types of parties or events or those kinds of things, respecting the capacity limits, we would still strongly encourage and require that they, adhere to the other guidance in terms of wearing face coverings and those types of things in that public space.
And I'm going to only add, I think the one thing I would say about this is the rules apply to food service establishments. And I think that is based, we talk about functions. So if you're doing a banquet and you have to follow the other food service provider provisions, I'm looking to our county attorney on the call to see how she would interpret that, because I think this is a pretty nuanced question, but I don't know. Look, there she comes.
Ask the question again.
So imagine you had a conference center, for example, and you had a gathering in there that maybe looks like a banquet with only 10 people. Obviously, you wouldn't want to break those rules. But could you stay in that gathering or party? Say it's a birthday party in an event. Can you stay in that for longer than an hour, or is that considered a food service establishment by virtue of the activity?
It could be. I'd need to see how the establishment was licensed. So a lot of it is really fact dependent. It's hard to answer. Sorry.
So that's certainly one where it's an executive order clarification, just like I just mentioned through the portal. So if you submit that and just give us some more details about the way the event is organized, we can answer that question more specifically. But I think generally speaking, we've tried to link not just to establishments, but also to activities. And so if you were doing an activity that looks like indoor dining in another venue, we would likely, depending on how your license is, as Ms. Kinship referred to, determine it one way or the other.
Exactly. And as you're seeking that clarification, the more information you can provide, the better. So the location, who runs it, if there's a caterer, all of that plays in.
Absolutely. All right, let me see if there's some more questions we have down here. I coach youth basketball and host tournaments. At what point will we be able or expect to be able to resume? This goes to sporting events.
There is no deadline. It's contingent upon, the levels of community transmission and where we are. And I think that even moving in that direction, returning back to normal sports may still have some, restrictions in place related to the types of activities and how they're done. I do know that, for example, both public and non-public schools are, attempting to come up with guidance related to return to sports and return to play. We have folks from the public health team who are part of those conversations to provide guidance. but there is no formal date to say on this date, we can go back to having tournaments and those types of activities. And as part of that, I suspect that, for example, looking at the collegiate level, they did return to play, but they have significant testing requirements in place. And even in the setting of extensive testing, numerous institutions have had issues where they've had to postpone and cancel games. And they're doing it all within the setting of not having any fans or outside spectators, or in most places, in a lot of places, as part of those events. So, say all that to say that no definitive date, and even then, I suspect the first wave of return to play will look different from what we're used to, with some level of restrictions in place for those different activities.
And I feel like, a lot of that answer is made in the point that we don't have the quote unquote target that people are looking for now to say, yes, that's when it's going to trigger. And we did have targets earlier, but we are so far past that point of, that point of those numbers we first started out with, because our numbers have gotten so bad so fast. So, hopefully, and you correct me if I'm wrong, hopefully, as our numbers continue to trend downward, then the decisions will be made to relax what and relax when at those points. And then we will get closer, like I think Dr. Stoddard said, towards the summer being a little bit better than now, but definitely not where it used to be. Well, I don't know.
I was going to say, I think one additional thing that we have that's different from where we were when we were having these conversations last year is that we do have vaccine candidates in place. And so one of the other numbers, in addition to hopefully seeing the community transmission levels come down even more, is that the percentage of folks in our community and society who are protected by the vaccine increases as well. So that, we're getting more people covered and more people protected, as well as driving down the community transmission, which ultimately leads to less cases and less transmission from person to person.
The other thing I would add, and some of the comments that we've gotten from some partners who have made requests, is that they're trying to get a head start on planning activities, for example, in the late spring, early summer. And in some cases, people have suggested, it may be easier for them to start planning and then cancel if it's impossible to do later, versus if we say you can do something, suppose we wait till May and then we say you can open up, you've done no planning for it, therefore you can't operate. And so if you're interested if you've got an activity like let's say a summer league that you're looking to schedule starting in June, we're certainly willing to have a conversation around how you can think about starting to plan those kinds of activities and plan that out. That's not to say that we might not open before June, but I know there's some out planning that people want to do for bigger type activities, and we're willing to engage in those conversations with the obvious caveat that I can't tell you what's going to happen next month, let alone 3 months from now. And so we're going to give you the best sort of guidance we can, and we're willing to work with you on some of those activities, but until we get closer, it's hard to give you a definitive yes, you can do something in March, April, May, or June, just not knowing how that looks. And so we're willing to engage in some longer term planning, because we've heard from some partners that it's, impossible. If we say we can do no planning on this, it's impossible to have it. But in some cases, some partners have said we're better off saying you can plan this, but we may have to cancel it at the last minute. And they found that to be a better option.
Yeah, absolutely. And I think one of the things I heard was that, there were some of the businesses wanted to do site visits with our staff so they could show us what would be in place when either the weather turned or the situation got better. But we didn't necessarily want to do that for every particular time that we heard it. But what you're saying is we will have conversations with them, most likely via phone or Zoom, that would allow us to talk through it with them so they can best prepare now for the upcoming season. Is that correct, Dr. Stoddard?
Right. So it's like we don't have any imminent plans to change our indoor sports or outdoor sports rules.
Right.
At this point. But, people want to do some medium-term planning over the next, let's say, 2 months from now. We don't know what we're going to look like in 2 months, but we're willing to engage in a conversation that allows you to, do what you would like to do to start planning those activities.
And can they submit those requests? I'm sorry. Is it okay if they submit those requests through the letter of approval process? That would just trigger that cycle?
Yeah.
Okay.
Yep.
All right.
Yep.
Thank you. I know you guys, how are we looking on time? How many minutes we got? Okay, real quick. We mentioned bubble earlier. When do you anticipate making recommendations for overnight summer camps that may want to operate in a bubble? I've heard of that before. I haven't heard of one lately, but I do know where people get tested and they all come in and everyone sort of isolates themselves in a outdoor setting. Is that something you guys would look to be as a more safer, sooner rather than later activity?
I think
Yeah,
consistent with what Dr. Stoddard said, yeah, it's one of those things that I think we'd be willing to look at, and provide
Yeah,
some
bubbles with testing can be fairly well done as long as they are true bubbles and you don't have introductions coming in from the outside on a regular basis. It's just a matter of when one person says bubble and another person says bubble, they may be talking about two different things. So we'd look at a plan, and I think that's what it comes down to. As I said in my introduction, I think we have talked to our Department of Recreations, and we've also talked to Maryland National Capital Park and Planning Commission about summertime activities and the possibility that, maybe you start with a 50% planning scenario and you have some scalability both ways from there. Because I don't think we're going to be doing 0% activities this summer as opposed to because we've learned a lot, and we'll obviously have vaccination and other things to improve upon from last summer. We're not thinking about a 0% summer, but we're not thinking about 100% summer either.
All right, 10-4. With the more infectious strains now in Maryland, how can we keep it safe with physical distancing, masking up, etc., while still opening for indoor dining? That seems like an infectious situation waiting to happen. Right.
Well, I'll say this from the health perspective, because that's what we provide health guidance on, is that really ultimately everything we're doing is harm reduction, and everything we have on any level of opening anything up carries risk. Everything we're doing short of an entire lockdown of everything is going to carry some risk. And so if what we've tried to do is provide as best guidance as we can in terms of if those activities were to resume, here are a host of measures from a public health perspective that we would recommend to mitigate transmission as much as possible. So hence, the rules around the length of time that folks are allowed to be in those spaces, as well as, strict enforcement of, when you're not eating and drinking, wearing your mask when you're sitting in company and talking with other folks. So we've tried to put forward the best public health guidance that we can to the measure to again try to maximize the safety parameters in place should those activities proceed. And that's very similar to the approach with for example, some of you may know, you've heard this before, I'm a tennis player. I play in a tennis league, and everyone has to wear a mask on the tennis court, even though it's indoors right now. And so, activities again carry risk, but we're trying to put forward public health guidance to try to mitigate transmission within those settings. But the concerns that are expressed by the individual asking that question are real, they're relevant, and that's why we continue to monitor as best as we can.
Yeah, and it boils down to risk tolerance at some level by the leadership of those who have to make those difficult decisions. It is not an easy decision when you're talking about health and economics in the same conversation. Once you get the vaccine, does that mean you won't be able to spread COVID? Is the answer to that different depending on which vaccine you get?
So actually, none of the vaccines are 100% in terms of preventing potential infection. Now, so when we say, for example, Moderna's 94.5% or Pfizer's 95%, or, I believe the preliminary information for the Johnson & Johnson vaccine, the one dose is 66%. It means that the way that number is calculated is everybody in the research trial who got, you take the number of people who got the vaccine in the research trial divided by the number of folks who didn't get the vaccine, they got the placebo and ended up getting it. And that's how you come up with those percentages. So roughly you can think of it this way: if a vaccine is 95% effective, there's still a 5% chance that you could get the particular illness that you're vaccinated against. Mm-hmm. The reality is, the importance of the vaccine is that in the small chance that you do get the illness, the symptoms will be significantly decreased. Now, at the same time, that does mean that you could still carry it and transmit it to another individual.
All right, that was pretty clear. The basketball comment that we had earlier, there was a follow-up, and it was, would private basketball follow public school rules and be safe? So I'm not sure if there's a difference there between the two, in your opinion, on the advice that you would give for being safe, whether it's public or private basketball.
No, we wouldn't discriminate in terms of whether it's public or non-public. I will say this is that, since MCPS has been closed, it's not been an issue for them, but, we did meet with non-public school leadership who had significant concerns about the risk of their student athletes participating in sports outside of school time, whether it's through club or travel. And some of those institutions did put in rules to say that if you're participating in that, particularly if you're traveling to other places that do have high levels of community transmission, you actually put the rest of the student body at risk when you come back into the space. And so I know a number of institutions required that any students who were participating in those types of activities and sports to stay virtual. They were not allowed to come back into the classroom, into the hybrid models. So it'll be interesting, again, as we move forward to see how each of those different types of schools move forward with that guidance. And, we'll continue to provide guidance from a health and safety perspective in terms of the parameters that they need to put into place. But ultimately, the execution of, some of those rules and guidance, for example, making a decision to say, kids can't come back in and out of school, that lies solely within those their leadership.
All right, makes sense. And that kind of goes back with his or her follow-up saying, I'm attempting not to follow other organizations and holding them in Virginia to avoid our rules. So they thank you for your answer. So I think they're grateful in the guidance. And I think we got only one more. When will Montgomery County wait until all the federal CDC measures are funded and attained within all of our school buildings before expecting teachers to work in person? I'm not sure that's a question for this call. Am I right?
I mean, I think we would just generally say, obviously, we've been meeting with the school systems, both the non-publics as well as the public school system. And obviously, we're very supportive of the CDC recommendations around safety and cleanliness. I don't think we've specifically said, for example, I know the CDC director made some news yesterday saying that she didn't view vaccination as being a necessary component of bringing schools back in session, and we've generally, we're going to follow the CDC guidance with that. Now, we generally think that getting vaccinated and doing all these measures is an entirely good, safe, appropriate thing to be doing, but certainly I think we're leaving up to the schools to make that determination about based on both MCPS as well as the non-publics to make that determination in consultation with their faculty and staff.
Okay. And I know I heard you guys talk about air filtration systems in restaurants. Would we ever require them to update their system, or would that just be a best practice or something that we would recommend? To me, the requirement would be maybe going a little too far, but I'm asking the question for people.
Yeah, we have not and do not intend to require it. There are some really good changes that can be made for some really low costs. However, there are some changes that if you depending on your system, if you made certain changes, it could be both expensive and also could be terrible from a long-term environmental perspective. And so obviously, given the variability in systems, we don't like to make rules that we think about all of the partners that may have to implement them. There's certainly, again, some places that could very easily make minor, relatively inexpensive changes and have really provide good protection for those people in their spaces, which is always a good thing they should consider. Right. But we're not going to require, because some systems are differently designed, not just necessarily older, but if they're designed in a certain way, it's harder to make the wholesale changes in an inexpensive way and also in a way that doesn't produce long-term negative effects as well.
Absolutely. Great answers. Appreciate the conversation. I'm getting you out of here on that question. As always, on behalf of County Executive Mark Elrich, thank you both for your time, your answers, and Sylvia, your answers and inclusion are much appreciated. Business community looks forward to hearing more from you in the future. Hopefully things will get better, but until then, we'll keep doing what you say, practicing safe measures, paying attention to what your guidance is, and making sure that we do the best we can each and every single day. So thank you. I'll let you guys go. All right. So we have a little bit more to talk about. I am going to share my screen. What I want to talk to you now about are some grant programs that we actually have available. All right, so the Hotel Grant Relief Program. This grant program is open until Sunday, I believe. I believe it's Sunday, February 7th. And this grant program, we are providing money that has been designated for those accommodation areas that have 5 or more rooms, and particularly hotels and bed and breakfasts are included as well. If you have not seen or been able to apply for this grant program, please make sure that you check it out. And if you look at where I'm at right now, I'm on the Montgomery County Business Portal webpage for resources for businesses. This is where we keep all of our most up-to-date information, including the Restaurant Relief Grant Program Phase 2, which is being administered by EDC. EDC right now has gone to Phase 2 of their program, meaning that if you applied for Phase 1 as a restaurant owner and you received it, you do not need to apply again. That actually slows down the process, but you will still already be in line once they get through the newcomers. So the newcomers will be first. They will get a grant because they did not receive a grant in Phase 1, and then they will go to $5,000 grants for the remaining people who are in Phase 2. And I believe that one closes on the 10th, if I remember correctly. But again, these are programs and funding out there that you need to take advantage of so that you will ensure that you are getting the best help you can from our local advocates. And this money that you're seeing being spent is actually state aid that we got from the actual state of Maryland. So we, again, thank them for their partnership, and we're grateful to have them on our side. One new program I want to tell you about is the Small Business Energy Savings Support. This is through Montgomery County Green Bank. So if you are at that point of needing to revamp or reopen and reemerge into the market, they have a program that might be right up your alley. And this program will allow for you to get a loan up to 5 years. You can see it here with some flexible spending, but the goal of it is to support small businesses, allow them to have access to capital, which we know is desperate and needed so much throughout the community, to ensure that we actually are going to be ready to reopen, which is sort of the theme of everything we've been talking about. Not only what we're doing today, which we know that affects tomorrow, but making sure that we prepare the best way that we can. So I am going to stop sharing. I am going to see if we have any more questions. Okay. Here we go. We got one question that says, I tuned in late. Did these questions get answered? Any guidance on camps, maximum group sizes? So if you didn't hear the doctors on the camps question, the best thing to do is all camps are not created equal. We have still the letter of approval process, the LOA process available. We want you to send that into our process. They will evaluate it on an individual basis and most likely will have a conversation with you so that you will be getting the information that best allows for your particular situation. And that answer is varied based upon the fact that some camps are talking about creating a bubble. And if you create a bubble and people are getting tested, then you should have the ability to actually make sure that you are doing things the safest way possible. The timeline for rolling out guidelines on outdoor events and health statistics that will guide decisions for loosening restrictions. We did talk about that. We are currently, and the doctors are continuing to monitor where our numbers are. We don't have a set goal that we can point to right now like we did back in the very beginning. Our numbers are very higher than we would want them and expect them to be. And to be honest with you, the decision that we're making right now to relax the restrictions are still coming at a cost where our numbers of health safety are not exactly where people who are our public health officials, and that's what their subject matter expertise is, would say that it's time to do that. But we have to make some tough choices. We have to balance the saving lives versus saving the economy. And I think that that's what our leadership is doing. And the last part of that same question is what are those guidelines? I think, what will those guidelines be, and if they are different given in the fall? They will be different from what was given in the fall. I can say they might be different from in the fall. It depends on where we start back at when we are actually relaxing those restrictions. We could go right back to where we were in the fall as a baseline and go up from there, or we could actually jump up and over that. It just depends. That decision and those decisions are going to be made a little later in time once we actually get closer to the summer and more of the vaccine has been distributed and they are socializing themselves throughout the community and reducing the risk. The next question is, will restaurants be required to have their, we talked about, I'm sorry. Next, I'm sorry, it says, is this town hall being recorded in case there are folks who are missing out with access later? Yes, so this town hall is being recorded. You will have access to it once it ends. The link that actually is the same link that you used to get into it should be up for 90 days. And we're also, if I remember correctly, we're also cataloging these on our website as well. So please go to the Montgomery County website, look under the resources for businesses page, and you should be able to find them there also. I believe that's all the questions. Let me make sure I didn't miss anything. I think I got through the ones in the chat, so I think that we're good. Oh, wait a minute. Here comes one that just came in. When thinking ahead for the spring and summer, is the county working towards establishing online automated forms to process farmers market applications, temporary food service licenses, or other paperwork that needs to be submitted by fax or in person? Absolutely. Everything that the county has been looking at right now has been on a gradual transition to ensure, one, that in-person contact is as limited as possible, and two, that those same activities can keep going by leveraging technology. So absolutely, you should definitely, when you talk about the automated form for processing farmer market applications, please touch base with our agricultural director, Jeremy Chris. I'm sure their website should have information on it that will guide you to being able to do that as quickly as possible. Second part of that question, given the increased reliance that community members have had on farmers markets during the pandemic as an outdoor and open air food access retail option, would the county be amenable to revisiting the current pricing structure for farmers marketing fees? As of now, a farmers market vendor selling packaged food, beverage food must pay $175 per year, while farmers pay $50 per year. I believe these fees are evaluated every single year. This is a question that is very specific to our agricultural department, so we'll have to get them to weigh in on this and maybe put something on their website that would allow for this question to be answered for everyone at the same time. The county has been very aware and very empathetic to everything that everyone is going through. So even while reducing fees on our end causes us another issue on the revenue stream, and we do have funds for rainy days, this is a perfect time to use those funds, those considerations are still being kept on the table. I don't want you to think that we are not considering those because of everything that we're going through. I think we're more empathetic to what you're going through. So please, yes, we will get this answer for this question as soon as we can through our Department of Agriculture and get it on their website. So that is the last question. On that, I'm going to let you all go. Please continue to be safe, wear your mask, do everything that the doctors say, as well as follow the leadership of Dr. Fauci and CDC and others who are designed to keep us as safe as possible for as long as possible. I want to thank you for joining me today. I thank them again for joining us for the conversation. And until we speak again, please be safe and take care.